My name is Chelsea Torres, and for the Policy Video Journal assignment, I focused on the Family and Medical Leave Act of 1993. The act was sponsored by William Ford, who was a previous Democrat representative for Michigan. The act was first introduced on January 2, 1993. On February 3, 1993, the House passed the act with votes of 265 to 163. It then passed the Senate with changes with votes of 71 to 27 on February 4, 1993. And it was later sent back to the House to have the changes approved. The act was finally enacted on February 5, 1993 when it was signed by President Bill Clinton. The purpose of the act is for employers to allow their employees to take an unpaid leave of 12 weeks after the birth of their child or adoption, or due to their own health condition or that of an immediate family member. The manifest goal is to grant family and temporary medical leave under certain circumstances. The policy was developed in a way that is equal for both women and men and that is suitable for employers. One latent goal is that by enabling individuals to keep their job, it helps the U.S. economy growth. That is because there will be a less rate of unemployment after a leave. Since mothers are the most affected after a birth of a child, it gives women the opportunity to continue working after the leave. Not having a job could particularly affect single mothers more because they are the only source of income. Consequently, it can increase the need of the people, which would require more support and funding from the government to provide assistance. One benefit is that individuals that take a leave can keep their health insurance. If a person needs to keep their health insurance because it is necessary for them to cover their medical bills, they don't have to worry about not being able to keep it in the meantime that they aren't working. Another benefit is that once the employee returns to the workplace, the employer has the responsibility of letting the employee resume the same position or an equivalent one that they had before they left. The employee is able to leave without it affecting the benefits or pay they received before taking a temporary leave. Although there are benefits to the Family and Medical Leave Act, there are also problems. One of the problems is that not all workforce is eligible for leave under the FMLA. Also, FMLA requires an unpaid leave. In this graph, we can see that only 59% of employees in the U.S. are eligible to take leave under the FMLA, and 41% that are not eligible. We can also see that only 16% of the covered employers took a leave under the FMLA. Many employees are not covered by the FMLA due to the many limitations that exist in order to receive coverage. This affects individuals that work for employers that are not covered, those who work part-time jobs, or have not worked a certain amount of hours within a year. Also, many of the workers that could have taken a leave under FMLA don't because they can't afford it. In the U.S., only 12% of private sector workers have access to paid family leave. Some states like California, New Jersey, and Rhode Island have already passed laws for paid family leave. In those states, it has been shown to be beneficial in various ways. It improves the health and well-being of parents and children. It gives fathers the opportunity to be involved in the care of their child, and it improves the profitability and productivity for small businesses. Currently in Texas, there are no laws that require a paid leave. About 17.2% of the population in Texas is living under the poverty level. There is a big percentage of households that live in poverty, many of which consist of female-headed households. The unpaid leave greatly affects this population in Texas because it's harder for them to take a leave without worrying about the bills they have to pay. It is necessary to have a policy redress that considers the employees that aren't covered by the FMLA and also a paid leave which would benefit the states and families.